Hello, it's Heather, and I am sitting outside of a Starbucks. I just finished with class for the day, and I thought I would do a video because I have not had the time or inclination to do one while sitting at home. So I'm going to do one now. Um, we had midterms last week, and those went fairly well. Had midterms in two classes. The other class, she doesn't do a midterm and a final. She just does like test 1, 2, and 3. So I had test 1 some weeks ago. And that went okay. I didn't do as well on that one as I wanted to. I didn't do as well as I thought I had when leaving the test. So I need to work a little bit more in that class. That was pathology, so diseases and whatnot. The part that I thought that I was going to struggle on was the treatments. So, given these treatment options for this disease, what would you pick? Choose all that apply. And I thought that I struggled a little bit with that section. I thought, well, maybe I didn't pick all of the treatments. Maybe I only picked 2, but maybe all of them were correct, or maybe 3 of them were correct, or whatever. But it turned out that I actually got all of the treatment parts correct. So all of the questions that I had missed on that were earlier in the test. Some I misunderstood the question. There were a couple where I just did not know what the answer was. So I need to study a little bit more for that class for sure. I've um, I've tried to work on that. Been doing some of the practice tests that she had available for each unit, and I put those in Quizlet. So I've been working on studying more for that class. I mean, I didn't do badly. I just didn't do as well as I personally like to do. And then the first of my 2 midterms, I did very well on that one. I actually only missed one question, and then I got some of the extra credit points, so I actually ended up with higher than 100% on that midterm, so I was really happy with that. I knew that I had done well. I thought that I had done well after the first one where I thought I had done, it had gone really well and it didn't. I was a little bit nervous for that first midterm, but yeah, so that one went really well. We just went over that in class today to look at what we got wrong, and the only one that I got wrong on that test was asking if you're using a McGill laryngoscope, what structure does it press on? And the answer was vallicula, and I had absolutely no clue whatsoever. I did not know that that's what the answer was. I think I said like adenoids, or I mean, I knew that I wasn't right, but I had no clue what the answer was. So that was the one that I got wrong. We had ABG interpretation on that test. I don't really have too much of a trouble with ABG interpretation. Every so often I get caught up on trying to figure out acute, chronic, acute on chronic, that sort of thing. But I did fine on this test. So, and then the midterm in my other class, which is it's not really a class. We have a midterm and a final, but it's attached to our clinicals. So the majority of our grade, half of our grade comes from the midterm and the final, and then the other half comes from work that we do in clinicals. So luckily, the 91 that I got on that test is hopefully going to be mitigated by getting everything done in clinicals that I need to do, because for me, a 91 is not a score that I am happy with, and I thought that I had done better on that test, so I was really disappointed that I hadn't. I did go to my instructor's office to look at the test the day after because I was really curious about what I had missed. There were 3 questions that I shouldn't have missed, that I only missed because I didn't take enough time to make certain that I was understanding what the question was asking, and so I was irritated with myself over that because I should not have missed at least those 3, and if I hadn't missed those 3, I would have gotten an A on the test. So I have a little bit more work to do for that class. He has a rather extensive study guide for that one, and I guess I just need to spend more time on it. I thought that I had, but not enough, I guess. his questions were worded very differently than how the study guide presented it. So I think that maybe that is why. But anyway, I know that grades, in the real world, grades do not matter. I only use grades for a personal motivator while I'm in school to make sure that I'm keeping up with my studying, make sure that I'm doing the best that I can. But let's all be honest, grades mean nothing. Once you are done with school, once you have your degree, once you pass your boards, your grades mean literally nothing. No one who's hiring you is going to look and see what your grades were. So if you don't have the grades that you really want to have, don't despair. You're probably going to be just fine. The main thing you need to worry about is making sure that you understand the job that you're doing and why you're doing things and how to do what you're supposed to do. But if that doesn't translate into straight A's, that's perfectly fine. So the only other thing we've been doing, classes this semester I actually feel have been pretty easy compared to last semester. I feel like last semester's lecture classes were much more difficult than they are this time, and I think that that's just because of the sheer volume of material that you had to learn in the first semester, and the fact that it was material that you are not at all familiar with, like tank factors and names for O2 systems, and I mean just things that you're not going to come across in everyday life. So that's why I feel like last semester lecture class wise was more difficult. This semester I feel like we've just kind of been putting to use stuff that we learned last semester. So the classes themselves have actually been pretty easy. Oh, there's a cute baby. Sorry, I got distracted by the adorable baby. So clinicals have been going really well. We need 300 hours this semester in our clinicals, and I have about 200 so far, so I'm doing well on that. I need to pick up a few more precepting 12-hour precept days in April. But as long as I keep what I currently have on my calendar and just add a few, I will make it to 300 without any problems whatsoever. Been doing fine on my skills that I need to have done. All of my skills that had to be checked off, I had done within the first 2 weeks. The only other thing that we have to do is we have to get 15 successful ABGs by December sometime. I currently have 14 successful ABGs, so I've missed one, so I've tried 15 and I've gotten 14. So, I mean, I'm going to have that done long before we have to for class. So, yeah, clinicals have been going really well. I have gone to one hospital that I have found I don't like as well as the others that I've been to. Not that there's anything wrong with the hospital or the people who work there. It's just a personality thing. Of the hospitals that I've been to, this particular one just doesn't match my particular style and personality and all that as well. So I really appreciate that I live in an area that has a lot of hospitals, and we go to a lot of different hospitals during our clinicals, because you can kind of get a feel for, this is the kind of place I want to work, or this isn't the kind of place I want to work. So I think that that's really helpful. So far I have 2 hospitals, they're kind of at the top of my list, and a couple of others that are at the bottom of my list. And there's probably some others that would go in the middle ground, but I haven't been to all of them yet. That we still have time to go to some of the other hospitals in the area. So part of clinicals is treating it like a job interview, making a good impression while you're there, making sure that you're on time, being willing to do the work. You have to show that if this is a place you want to work, and even if you don't want to work at that particular hospital, it's a fairly small community. People know each other, and people, might talk, and you don't want to be the student, that this director is talking to the director from that hospital and saying, oh gosh, we had this one student and we, they just didn't want to do anything, and they wanted to leave early and they came in late. Don't be that person. Be on time for your clinicals. You should be seeing your entire program as a job interview, basically. And we spend so much time in the hospitals working with the people that you might later be working with, you have got to make a good impression. So that's my big takeaway from clinicals is be there to learn. Don't be there just to get your hours in. Be there for the experience. Be there to make sure that you are the best therapist that you can be once you finally get to that point of, passing your boards and being employed. You want to make sure that you have done everything you can in your clinicals to put yourself in a good position to treat your patients the way that you should, the way that they deserve to be treated. And if you go to your clinicals and you find that you're really not enjoying it, that you don't like the work that you're doing, that you just are counting the hours until you can go home, maybe rethink RT school if that's the case. And decide if this is really something you want to be dedicated to, because when you're in a healthcare profession like this, you really have to want to do this job. This isn't something where I feel like you should just be, clocking in, doing my job, go home, and, hopefully you're getting into something that you enjoy. I know that I have been. I've absolutely loved all of the time that I've spent at clinical. Some of it's been boring because sometimes there's frankly not that much going on. And currently with the coronavirus that's going around, as students, we are now restricted. We're not allowed to go in any isolation rooms because they're trying to save the PPE just in case it is needed if it gets worse. And they don't want to be wasting PPE having 5 students go in a room with 1 patient. So some stuff that we could have done before, like we were supposed to go see a bronchoscopy, a bedside bronch yesterday, and we didn't get to go because it ended up being a patient who was diagnosed with flu. And so that's a droplet room. We aren't allowed to go into any rooms where we need extra PPE beyond gloves. So, but I have gotten so many experiences that have been really fantastic. We've gotten to stand in on rounds in ICU multiple times, and there's a couple of doctors in particular who are really great about making certain that they give extra information or ask questions of nurses or other staff in order to make things easier for us to understand, because they know that we're standing there listening in. We've had one doctor who actually turned to us and started asking us questions, and I was just, really grateful that I knew the answer to the questions he was asking. But just stay involved in your clinicals. Make sure that you are learning as much as you can, because you are going to need that time. I'm certain that everything that I am learning in clinicals is going to help me later on when trying to get a job and when actually doing that job. And I'm starting to ramble and it's starting to get a little bit lengthy, so I'm just going to say, if you have any questions, drop your questions in the comments down below, and I will see you next time.